Hydro field cuts through my neighborhood.
Is it working? Hi, everybody. Welcome to another episode of Fearlessly Authentic. I'm Lucky. It's just me tonight. Steve will be in and out. So, yeah, we're gonna cover this case. Prisha Mosley, what happened with her, and she's a detransitioner. And there was a Blockbuster lawsuit that was filed, and there's more lawsuits like coming. Can you guys hear me okay? I just want to check and make sure that it's all set before I get into this. Yeah, FX, that's a rumor. I don't know. I don't know what rumor you think this is. Yeah, I'm really excited for her as well. Let me just make sure everything's up and going. Okay. So I'm gonna jump right in because I think that this is a really, really important case. I when I saw this information come out, I decided that I was gonna add an extra show on this week. So I have 4 shows in a row, which isn't normal for me, but I felt like this was really important to cover. I've seen some other quick coverage of it, but I feel like, she deserves to have an entire show dedicated to what happened to her. And I reached out to Prisha, and so I could tell you that she told me that everything that is in this article that is from the Daily Mail, that it is verified. And she said that there was only one mistake that they made, which was her age. They call her 24 and then they call her 25, and she's 25 years old. So everything has been verified from her directly, that this is a legitimate, true story about what happened. They properly represented her. So I felt like that was really important to make sure, because, sometimes, people will say like the Daily Mail is, it isn't a reliable source or what have you. So I wanted to make sure that, before I covered this, that it really was. And in here, there is a 53-page court filing that I also read. And we'll go through some of that. We're not going to go through every page of it because it would take absolutely forever for me to do that. But there's a really good section that I have outlined that we're going to talk about. So this and everything will be available in the show notes below. I have some clips as well that we'll be covering. So this is the Daily Mail. Excuse my squinting if I'm squinting at all, like reading a lot on the computer the last couple of days and trying to make sure I really went through this makes it where my eyes get a little bit strained. So this is from the 18th of July of 2023, and it says exclusive: a young North Carolina woman sues the doctors who put her on testosterone at age 17, saying she needed therapy, not a double mastectomy, in the latest Blockbuster detransition lawsuit. There's several of these. Another one just dropped that I saw that I'm probably going to end up covering that one as well. Another detransitioner from Texas. So this one right here, a doctor told Mosley she would grow a penis from testosterone jabs. Imagine that. The deception right there. And it's outlined. It's all backed. This is all backed with evidence. So medics were interested in money and glory than helping her. Were more interested in money and glory than helping her, it is claimed. Read the more about her efforts to raise funds to reconstruct her chest as well. Yes, she has a GoFundMe. So this right here, this first clip that shows up right here, there's actually a video of this, and we're gonna play that video as well. So, a North Carolina woman is suing the medical team that put her on testosterone at age 17 and surgically removed her breast the next year, saying she was fast tracked into transgender care for profit when she really needed therapy. Prisha Mosley, 25, says she was confused and battling mental health problems when clinicians suggested cross sex hormones and a double breast removal after brief consultations, one lasting only minutes. That's just astonishing. This was, I can't imagine. In her 53-page complaint, she says the doctors lied, including by saying testosterone jabs should solve her problems and make her grow a penis. She since decided to detransition and live as a woman and seeks financial damages. The treatments left irreversible scars, she says, including a deep voice and facial hair, pain in her neck, shoulders, and a damaged vagina, and she will not be able to breastfeed and may be infertile. Actually, I'm gonna play the. I want to play the video. All right, hang on. Let me. No, that's not what I wanted to do. No, 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 no. All right, there it is. So let me just pull it this up, and we can play this little clip. Make sure it's not going to play on me, because they always do. There we go. And I'm going to take the Daily Mail down for a second, and I'm going to add another. So I'm going to stop sharing that one, and I'm going to add a different one. Okay. Sorry if it's wonky with just me doing this. There we go. All right. I'm going to go ahead and mute myself, and I'm going to play this, and we're going to hear a little bit about her story.
Bragging about how I lost like 8 pounds in a day. That was the most exciting part to me about this top surgery. I felt like I got useless lumps of fat cut off. I also wanted liposuction, but they just wouldn't give it to me. So, I got my chest cut off. Apparently, when you have a mental disorder, fixing your body, changing your body isn't the answer. That liposuction is not a treatment for anorexia, but surgery is a treatment for gender dysphoria. It was kind of like I just hit a black wall around 13 or 12 years old. Like, I literally stopped enjoying things. Like, nothing brought me joy. I couldn't connect with my family. I started having a lot of trouble with my mental health, constant anxiety, depression, and I eventually began not eating and self harming. I was diagnosed with borderline personality disorder and anorexia. My hair was falling out, my skin was gray. I was skeletal. Like, I I could stick my whole hand like in my stomach between my rib cage. I just hated myself and my body. I think the longest I went without eating was 11 days. So I was hospitalized because of that. When I was about 15, I started hearing about transgenderism on the internet, and a lot of the things I heard really rang true with me, like, you are trans if, and it was things like, you hate your body, you don't feel comfortable with it, you want to be a different person. And with everything I was going through, I thought that if I aligned my body with my brain or something like that, I would feel better. The trans community really love bombed me. I hated myself, and I was convinced that everyone around me hated me. So when they started really celebrating the fact that I was born in the wrong body, I felt cared for, I felt loved. It was genuine love bombing. It was like kindness over the top all of the time. I actually started the social transition with changing my name and clothes offline at 15. My mom was in really bad denial about it and really upset and against it, but I was not willing to listen to her because of choices she had made and like a struggle she was going through with alcoholism and drug use. So my dad kind of had like a prove it attitude about it. He was like, if you're trans, you're going to start showing symptoms of being trans. So, like, make your appointments and prove it's real. I went online and I found someone who called themselves a transgender expert. But when I went in for my first time appointment, she immediately gave me my letter of recommendation for both hormones and surgery, which I took to the first endocrinologist and surgeon that I could find, and they accepted the letters and gave me what I wanted. And so then I started the hormones. And then the minute I turned 18, I had my top surgery. It was actually one of three surgeries that day. I was working at Panera Bread. I paid for half of it, about 3,400 upfront in cash at 18 years old. And then the rest I put on care credit, which is like a medical credit card. It went to like debt and everything. Cause I couldn't work at my job for a couple months because I couldn't lift up my arm, and then I ended up quitting because I left my whole family to move with someone I met online in Florida, who was affirming me. Looking back, I was so clearly not well. Like, I was just so unstable. Like, I literally didn't want to be alive. I remember my doctors had to ask me questions like, who's the president right now? Like, just because I was so far from reality. And I just don't understand how, at that young age, plus literally not being with reality, I could make those decisions that would change my life forever. I was in denial for a very long time because I was like, I put so much into this, so much money, so much energy. I lost family members for this, and I changed my whole body for this. So when the dialectical behavioral therapy helped me for the borderline personality disorder, and I wasn't suicidal anymore, I had a lot more clarity, and I started going on the journey to healing. And when I treated that, all of the symptoms, started getting better. Nothing that I did to transition treated those things that were causing me mental suffering. I left the really bad relationship I was in with another trans person. And I moved away. I actually applied to random jobs all over the country, and that's how I moved here. All of the love bombing that I was getting like completely stopped and turned into like hate. It's scary because like they told me they'd be there forever, and like that's why it was okay to cut off my family. Like they told me, anyone who doesn't affirm you and agree with you would rather you be dead than trans. And then as soon as I found out like it was a lie and not for me, they just completely turned on me. Like they hate me now. I've had hair growth on my entire body. Like I got some on my chest, my stomach, my face. I'm currently paying out of pocket for laser hair removal, and it's expensive and painful. And then breast reconstruction, I have to find a plastic surgeon for that. And I actually set up a first time appointment with one in December. We're just going to see what's even possible. Like, all of the tissue is gone, it's like completely flat and tight. This is kind of personal, but I'm like really messed up about what they did to my nipples. I didn't understand that they were going to be like fully cutting them off, resizing them, and reattaching them. Like, I feel like they're not mine. I don't have hips anymore. My shoulders are bigger. I've also had like vaginal dryness and vaginal atrophy, and that worries me a lot. And it makes things like painful um and not super functional. When I started testosterone, I had also recently been sexually assaulted, and they told me a little bit about like how that could cause problems having sex in the future and mess with my fertility. But after that had just happened, I saw it as a good thing. I didn't want anyone to ever be able to like go inside ever again. So I thought like atrophy sounded like a good thing as far as I could even understand it. I've worked through the trauma in therapy, which is what I originally needed to do. And I no longer like fear men and fear sex, and I want to have children and get married now. And I'm like, I made the decision to possibly lose all of that, so young and so traumatized. I honestly like feel like loving me is a lot to ask at this point. I really feel like every other woman is like a better option than me because they have their original body and they didn't try to live a lie and they didn't mutilate themselves. I don't blame my parents. I think the parents are confused and hurting. Like, I view the parents as victims, honestly. Like, they are targeted for so much emotional manipulation. I wonder what was in it for the doctors. Like, did they genuinely think they were helping and there's like no research, or was it just about money? I can't put myself in a position where I would put another me at that age on hormones and think it was the right thing. I can't believe this happened. I ruined my life. Um, when you break it down, I decided that I didn't want to be a woman before I had ever even experienced being a woman. I had no idea what being a woman was like because I was a child. And now I feel like I will never entirely know. Um, I I want to say that I really feel like some people in the trans community and the trans medicalists and the doctors really, really target the most vulnerable of us. I have borderline personality disorder, and I know for a fact that this is the reason for my transition. Um, it's a very difficult mental illness, and one of the core features is not having any sense of self or identity. And my doctors knew this. I told them, even though they didn't ask, um, that I had been diagnosed with BPD. Um, and it was all fine to them. I wasn't happy as a girl, so that meant I was a boy and I was trans. And so I I just took the cure that was handed to me.
Um, I was told that I was being given a cure, and I wouldn't want to kill myself anymore. And it wasn't true. No, I didn't want to cry in this video, but this is such a hard thing to talk about. I lost a lot of things to this, and I just hope that anyone else who's going through what I went through as a young girl will not be prescribed hormones and surgery because of other things. Um, you know, there are so many mental health disorders that make you hate your body, and the solution isn't to change your body, it's to fix your brain, you know? Um, I just don't want anyone else to ever feel this way. I lost my voice, I lost my chest. I don't know if I'm going to be able to have kids. Um, I feel like no one wants to date me or love me because I'm ruined.
It's recent that I can't be in denial anymore. Like, there's just no room for it as I'm going forward with telling my story. So, like, it's sudden grief, you know? Like, mourning, like, the trans community tells you, like, to kill your old self, it's your dead name and all of that. Like, and I literally feel like I killed a child and it was me.
So that is just a little bit of the story. It's not the whole story. There's a lot more to this. And from the surface, just listening to that, you can judge it and say, well, she was an adult and what she went through, she made those choices herself, right? It's easy to say that without knowing the details that we're going to cover tonight. And the details that we cover tonight, I mean, it was hard to read through it in the court documents. It was extremely difficult to get through it. I can't imagine living through it. Um, so I'm going to go back to the article now that that's what this image here on that I'm going to put on the screen. That's what this is from in the article. It's from what the video that I just played. I'll be putting the link to the video and to the article and the show notes and the other videos that I'm going to have to play. But there's more to it. It's just not as black and white as that, right? These doctors completely manipulated her. And it's all outlined in the court documents and how that happened and the manipulation that happened and the way that the healthcare system absolutely failed her. It's not a matter of, her age. She wasn't given informed consent, and they outline that in those documents. She gets a lot of blame. She gets a lot of people that say, well, you were 18 when you did the surgery and like somehow like that's okay. It's not. The whole process that she went through, it's not okay. It's horrifying. She was failed as a young lady. The medical system failed her. And so let's get back into this, and we'll go over more of those court documents coming up here soon. So it says she was 24 in this picture. but actually I confirmed with her that is the one typo that they did make, was that she is 25, and they say it up here further. They say it up here in the article. So in her 53-page complaint, she says the doctors lied, including by saying testosterone jabs would solve her problems and make her grow a penis. She has since decided to detransition and live as a woman and seeks financial damages. The treatment left irreversible scars, she says, including a deep voice and facial hair. And she's told me before how her voice actually will hurt. Her voice hurts because of the testosterone damage. And her body just hurts from the testosterone. Like I've had, I've spoken with her. And leading up to covering this tonight, I wanted to make sure that, I gave her the best, most fair coverage that I could, because she deserves that. So these treatments were left irreversible scars, a deep voice in the body, facial hair, pain in her neck and shoulders, a damaged vagina, and she will not be able to breastfeed and may be infertile. She is the latest detransitioner to take legal action against her doctors in lawsuits that could provide pivotal in America's heated debate about transgender rights and the medical procedures, especially those on children. They lied when they told Mosley she was actually a boy. They lied when they told her that injecting testosterone in her body would solve her numerous profound mental and psychological health problems, says the complaint. They lied by omission, withholding critical information from her about the long-term adverse health consequences and permanent damage these treatments would cause her. Failing to inform her of alternative courses of treatment for her psychological problems. So, I mean, you do what, when you trust doctors, you do what they say. Who protects the vulnerable, though? Who protects the people? So heartbreaking. So her paper was filed in the Superior Court in Gaston County late on Monday. The name of the prosthetic surgeon, Eric Emerson, the clinic he worked at, Piedmont Plastic Surgery and Dermatology in Gaston County, and Bree Klein Fowler, a counselor at the clinic she worked at, Family Solutions. Also named Shauna Gordon, and the center she worked at, the Tree of Life Counseling, and Dr. Martha Perry, the provider she worked through, Moses Cone Medical Services. They are accused of various fraud charges, civil conspiracy, medical malpractice, negligent infliction of emotional distress, and unfair and deceptive trade practices. The defendants did not immediately answer the Daily Mail's request for comment. So Mosley discovered transgenderism online and started social transition to being a boy at age 15, believing it would help her anorexia, anxiety, depression, and recover from sexual assault she endured when she was 14. I mean, how many young ladies have, are sexual assault survivors? The defendants lied to and misled her into these treatments and procedures for the purpose of making money off of her and bolstering their credentials in the emerging field, the so-called gender affirming care. It is claimed. And all of this is backed up in the court documents. Dr. Perry, in January 2015, diagnosed Mosley with gender identity crisis after an 80-minute session and pushed her into having testosterone shots, it is claimed. There was over objections from her parents. Instead, they said their daughter had problems that needed treatment, but they were sidelined from key medical decisions, the papers allege. And that is in there too. See, and there's the court documents, 53 pages of it. We'll come back to that in a minute. In July, Gordon, a counselor, met Mosley for only a few minutes before telling her that changing her body to look more like a boy's body would solve her many psychological and mental health problems, it is claimed. Gordon then wrote a boilerplate letter that was riddled with inaccurate and misrepresentations, saying Mosley was ready to begin sex hormone treatment, which started when she was 17. The court papers state. Dr. Perry then devised a treatment plan for the patient. She said Mosley was undergoing male puberty and that this was part of the process. She would grow a penis, it is alleged. She did experience an enlarged clitoris, but that is not the penis she thought she would grow. When Dr. Perry told her she would grow one. Mosley, now a student at Big Rapids, Michigan, says she eventually decided to detransition and discovered the therapy could address her problems. She's trying to raise $15,000 to fund the laser hair removal and breast reconstruction surgery. She says will help her live as a woman again. She seeks unspecified financial damages in the court case. I decided to file a lawsuit because more needs to be done. That's what she told the Daily Mail. Just talking isn't enough. People who do harm need to be held accountable. I want justice. I want to stop preventable tragedy from happening to anyone else. And here is Dr. Eric. This is Eric Emerson and Dr. Martha Fairbanks Perry. These are the people. This is the plastic surgery and dermatology, the Tree of Life counseling on the right. Speaking with the Independent Women's Forum, Mosley said that she mutilated her body to stop being suicidal. That was the video that we watched. It didn't work, and now I have horrible scars and traumatic memories on top of the traumatic memories. She joins a growing list of young people who undergo irreversible trans medical procedures, but who regret them and sue the doctors and therapists they say are fast-tracked them into drugs and surgery. This includes prominent detransitioners such as Chloe Cole, Leila Jane in California, and Camille. I do not want to say their names wrong. Camille Kafil in Oregon. Gender affirming care is, as it is known, covers everything from puberty blockers to cross-sex hormones, and in a rare case for trans children under 18. Surgery. Several medical associations say such healthcare saves lives among a suicide-prone group. But opponents of trans ideology say sex is determined at birth and cannot be changed, and medical advisory groups have been hijacked by ideologues, and that politicians must intervene to stop parents, doctors, or therapists from permanently harming children. Actually, I say that the sex is determined at conception. It's not at birth. It's at conception. That's when it happens. And the doctors don't assign it. They observe it. It's very clear. The doctor doesn't wave a magic wand and say, I want a boy or a girl here. And that doesn't happen. I just want to clarify that in this article. So many are alarmed by the sharp uptick of teenage girls with autism and other mental health woes asking for a sex reassignment in recent years. And a new study linking puberty blockers to weaker bones and osteoporosis. And we've covered the puberty blockers before, how damaging they have been to women who have gotten them, and also the children, and what else they're used for. Whether to allow drugs and surgery for trans-identifying children has become a front line in America's culture wars, with Republicans pushing to outlaw gender-affirming care in some 20 states this year, including North Carolina. A recent YouGov survey of 1,000 across red and blue states found that Americans were largely against gender affirming procedures for children. Yeah, I've seen there was another article that I don't have off the top of my head, but they've done surveys and they refuse to release the information on these surveys because it shows that most people do not support gender affirming care for children. Some 61% rejected giving puberty blockers to 12-year-olds, and where 21% said it was acceptable. So remember, if you're not for gender affirming care, they will call you a transphobe, they will call you a bigot, and they will call you every name in the book. I'm used to it now. The truth is still the truth, and I'm still going to stand up for kids, and that's just all there is to it. And I'm going to stand up for people. I'm going to stand up for the vulnerable. So they also deem cross-sex hormones and breast surgeries unacceptable by similar margins. So that was the article in the Daily Mail. But here we have, let me see if I can make this bigger. I think I can make it bigger. I made it bigger on the other computer. If not, it's going to be really hard to read this. Sorry about this. It is super tiny on this computer. I wouldn't let me like. Oh, whoops, that's not what I meant to do. All right, let me see if I can get this. Okay. Gosh darn it. I didn't know this was going to be so difficult. All right, maybe if I do that. And move it around. All right, let me see. What page was that? It was like pretty far. All right, let me find out where I'm at. All right. I think I just skipped over it. So I suggest that everybody go in and take the time to read this entire thing. But I'm going to go through some of the actual what happened with the doctors, because this is what makes the case. This is what shows that this wasn't just like, oh yeah, she was rushed on a path and she got a surgery at 18. This is so much more than that. The way that she was treated, the way that these doctors acted, the way that they acted, and what they told her. I mean, like, I was blown away reading this. I was absolutely just, I could not believe it. Let me see if I can make this screen bigger for myself. No. Damn it. All right. I got something bigger, but now I can't see all of this. Yeah. Why is it going to be frustrating like this? All right. Maybe if I do that. All right. I think I should be able to read it now. Oh, sorry, this is frustrating. Okay, so yeah, like I was saying, I hope everyone will take the time to actually read through this and the complaint and see exactly what happened. But this is the counts at this part of it. On This is on page 41. So the count one, fraud, all defendants. The proceedings allegations are repeated and incorporated herein. Defendants falsely represented or concealed material facts, for instance, alleged in his complaint and jury demand. Each of the following defendants misrepresented to Prisha that she was actually a boy and that changing her body to look like a boy's body would solve her psychological and mental health problems. And I know for a fact, like, she verified with me that she was on antipsychotics and tranquilizers during this time. She told me that personally. So each of the defendants misrepresented her and told her that she would be in fact get a boy's body. Changing her body to a boy's body would solve her psychological and mental health problems. Defendants Dr. Perry and Gordon misrepresented to Prisha that injecting testosterone in her body would solve her psychological and mental health problems. Defendants Dr. Emerson and Klein Flower and Gordon misrepresented to Prisha that breast surgery would solve her psychological and mental health problems. Defendant Dr. Emerson misrepresented the nature and the effects of breast reduction surgery. And what does that mean? It means that they didn't put her forward to have just a regular radical double mastectomy. They filed this as if it was just a breast reduction. So they misled the way that they framed everything, and it's outlined in this. I was absolutely blown away by that. Let me see. I have notes about when it happened. Like if I go back to, let's see, like even just page 30 of this, we can start there. Just to get a little bit of the outline of, what happened. So she was only 15 when all this started. Or it was 2015 when all this started. But on or about January 13, 2016, when she was still 17 years old, Prisha met with defendant Dr. Emerson and defendant Pine Mount Plastic Surgery and Dermatology in Pennsylvania for consultation regarding what Dr. Emerson described in his notes as top surgery. Oh my gosh, you guys are so loud. Dr. Emerson noted that Prisha had a history of anxiety and anorexia, nervosa, and family history of depression, but he did not appear to follow up and perform a thorough assessment regarding these issues. Dr. Emerson did not appear to, from any evidence-based independent judgment, that the proposed surgical procedure was necessary and appropriate despite these issues. Oh my gosh. Dr. Emerson misled and deceived Prisha into thinking that surgery of her healthy breast would benefit her and that she needed this surgery. Furthermore, Dr. Emerson concealed the detrimental effects of surgery she would have, such as the loss of Prisha's breast, loss of ability to nurse a child, and physical and psychological pain. She didn't discover Dr. Emerson's misrepresentations, concealment, and wrongdoings until recently, until last year, and could not have discovered it prior to that time. And the exercise of reasonable diligence because she was vulnerable and suffering from a host of mental health issues. She was under Dr. Emerson's influence and trusted Dr. Emerson to take care of her, and She relied on and believed Dr. Emerson as an authority figure. Likewise, Prisha, under a disability, was incompetent and lacking capacity to discover the wrongdoings earlier. Because Prisha lacked significant capacity to manage her own affairs in this regard, and her host of where did I just go? Mental health issues, she was under Dr. Emerson's influence and trusted Dr. Emerson to take care of her. She relied on and believed Dr. Emerson as an authority figure. Likewise, Prisha was under a disability, was incompetent, and lacked capacity to discover the wrongdoing earlier. Did I just read that twice? Or did I say that twice? Because she lacks sufficient capacity to manage her own affairs in this regard, and her host of mental health issues and illnesses, including borderline personality disorder, caused her to lack significant capacity to exercise her legal rights or make or communicate important decisions concerning her person, whose mental health illnesses or similar conditions caused her to repress from her memory or disassociate, akin to repression, the wrongful acts of Dr. Emerson, until Prisha recently underwent therapy, which began to uncover some of those past events in her mind and eventually helped her realize that wrongdoing occurred and appropriate care was not provided. Sorry, I need to stop for 1 second. They don't even know what kind of letter that she needs. She's telling them what kind of letters that she needs. She's on these meds. They're ignoring all of her, her psychological issues that she's going through. She has all this trauma, and they're telling her that the solution is to transition and that you will turn into a boy. And they don't actually outline that what the effects are going to be. Steve, can you get the cat, please?
Do what you're doing.
So Dr. Perry continued her deception of Prisha and convinced her that removing her uterus and ovaries at age 18 was medically appropriate, despite Prisha undergoing medical struggles with testosterone injections had not cured. They made her think that this was like the only thing that was going to make her feel better, that this was going to be the thing that was going to be the solution. I can't imagine going to a doctor and thinking that you're going to get help and this is what you're handed. And they all worked together. All these doctors worked in unison together to do this to a young lady. It's absolutely, it's outrageous. I mean, I have so much compassion for these people that have gone through these issues. I mean, they continually ignore the fact that she has borderline personality disorder. She has OCD. Her parents speak up and they sideline her parents through this process. They make her think that they can't even legally that they're not even legally allowed to object to any of this. They're grooming her the entire time. They're emailing with her back and forth. they misrepresent themselves. They act as though they are like, a gender affirming already, but they weren't part of the W path. So they go on here, and this is on January 15, 2016. Dr. Perry noted that the laboratory test results show that her testosterone was higher than Dr. Perry's goal for Prisha. Dr. Perry did not stop the testosterone prescription. Instead, she noted she would consider adjusting testosterone if the dose doesn't, the level increases further. Okay, so that was in January, and this is in February. On February 16th, or February 12th, 2016, Miss Hacker, the nurse practitioner working under Dr. Perry's supervision, noted that Prisha's anxiety was not well controlled. And this has been the case for some time. That the medication change would be considered if this continued. And they continue they have her on Ativan. So they say continue Ativan as needed. Consider med change, SNRI, serotonin, norepinephrine, reuptake inhibitors in the future if she still continues to have anxiety and not well controlled. Then April 5th, 2016, she turned 18. Appeared this problem continued. And the Dr. Perry noted discussing trying other anxiety reduction strategies, asking the patient to track anxiety when she is taking Ativan, so we can get better understanding of the trend of use. Dr. Perry did not disclose to Prisha that testosterone injections were not curing her mental health problems. So all this time, she's under this impression that this is curing her mental health. And we have Exlansic coming on tomorrow, and she knows a lot more about this. And so I am really looking forward to talking to her about this, because the testosterone can give people temporary relief from symptoms, but even in this case, it wasn't giving her the relief that she needed. Dr. Perry did not disclose. Okay, whoops, I already said that. On April 13, 2016, Dr. Perry wrote to Prisha regarding laboratory results, stating that her estrogen was nicely suppressed and testosterone level was in the range we would like. Meaning the range Dr. Perry deemed appropriate. Prisha demonstrating her continued vulnerability even after turning 18, her dependence on Dr. Perry and the lack of medical training and understanding, responded, "I'm so glad my testosterone is a good range again. It would make me so sad to lower it just psychologically, I suppose. I am also glad my estrogen is going down finally." Dr. Perry, showing that she had built a rapport with Prisha and gained her trust, replied, "Yes, it's good to see your hormones are doing what we want them to do." Then we're further on into June 30th, 2016. Nearly a year after starting testosterone injections in July 2015, Prisha again completed psychological tests. Her scores, now they earlier in this, they talk about her scores over and over again and what they exactly mean and the numbers and what the actual range is. So I suggest looking through the actual court documents to get all of that relative information to better understand. But her scores kept going up. And right here, it talks about how, despite that, Dr. Perry continues to prescribe testosterone injections and failed to disclose to Prisha that the testosterone therapy was not curing her severe mental illness. And this is it continues over and over and over again. These doctors really fail her over and over and over again. And they work together. to get this all fast tracked. The records produced by Cone Health indicate that July and August in 2016, Dr. Perry discussed surgery with Prisha, including the idea of removing her uterus and ovaries. She was still a teenager, only 18 years at the time. And Dr. Perry comments caused excitement for her. I'm so excited about the things you told me about the surgery. I am calling the doctor about an ultrasound on Tuesday, and I will tell you when my appointment is. Dr. Perry reported that Prisha's pelvic ultrasound was normal and described this as good news from a health standpoint, but characterized it as in negative terms for the hysterectomy. Dr. Perry hoped to guide Prisha into getting the hysterectomy. Is what they're referring to. You may have already seen your pelvic ultrasound was normal. This is good news from a health standpoint, but it means we have to seek another avenue for hysterectomy. Why were they like so adamant to get a young lady a hysterectomy like that? Oh, I need to move this back up. So Dr. Perry even went far as to contact several OBGYNs to ask about the hysterectomy and stated, unfortunately, she didn't learn anything new. Dr. Perry explained that according to the OBGYNs, a diagnosis would be needed to remove your uterus and ovaries, but suggested that Prisha contact local support groups, presumably to see if they could get around the diagnosis requirement. Dr. Perry thus continued her deception and misrepresenting to Prisha the medicalization and changing her body to look like a boy's body would solve her mental health problems. As described as alleged in this complaint, the jury demand, Prisha did not discover the fraud and wrongdoing until recently because she trusted Dr. Perry and lacked the capacity to understand that Dr. Perry was harming her and misleading her. So defendant Klein Fowler again misrepresented and concealed material facts to recommend Prisha for top surgery and failed to follow her own cited standards in the process. After what appears to be a perfunctory discussion of plans for top surgery with defendant Klein Fowler on the January 7th and 28th of 2016, the issue does not appear again in Klein Fowler's notes until November of 2016. So all that time later, from January all the way until 2016, doesn't discuss any of this. It did not appear to explore or question the necessary appropriateness for basis such as a drastic procedure. And they're talking about her having her breasts removed at 18 years old. So the notes from their doctor indicate that she focused on Prisha processing the decision to undergo surgery. Klein Fowler noted Prisha had negative automatic thoughts, which Klein Fowler challenged. She also noted that she prompted Prisha to use coping skills to manage the anxiety as it rose regarding the surgery. If this surgery is affirmation care, then she shouldn't have to manage the anxiety leading up to it if that's really what she wanted to do. But like in that video I played earlier, she was like, yeah, I just thought I was just, I was anorexic and I was getting weight off of me. To her, it was just weight, and she didn't realize what it meant. She didn't realize that it meant that she wouldn't be able to breastfeed. When you're taking somebody who is not in the mental capacity to be able to give consent, and you're putting them on things and you're putting them on a path towards things, it's not their fault. These doctors failed her. So a few days later, down here on Prisha wrote the defendant Klein Fowler asking if she would recommend write a recommendation letter again. It was unclear whether the letter Klein Fowler wrote in January 2016 was presented to the surgeon, again demonstrating her vulnerability and trust of the reliance upon her doctors and counselors. Prisha stated, "It just needs to say that I'm really trans on T, meaning testosterone, 1.6 years, and I'm not crazy." Klein Fowler responded a few hours later, "Hey, I couldn't find the other one, so I wrote a new one. Just insert your doctor's name and it should be good to go. If not, let me know and I'll tweak it." The new one that Klein Fowler wrote was different from the first one, and they talk about this earlier. There's a lot of details in the court documents. So Fowler referred to WPATH guidelines in the new letter, but it was materially misleading. It was not appropriate basis for any surgery. So she didn't state. So this is the part that's really messed up. Klein Fowler did not state that she was qualified to write a letter recommending a vulnerable teenager for surgery to remove her healthy breast. She stated that she'd been meeting with Prisha in sessions to address issues related to gender dysphoria. I lost my spot again. Okay, there it is. But she was misleading and deceptive because Klein Fowler was not a transgender specialist and instead provided general counseling to Prisha. So this person is writing the letters to have a healthy teenager have her breast cut off, and she's not even trained to do this. As noted above in allegations regarding the defendant Gordon, the WPATH SOC 7, which is the version in force at all relevant times set forth, recommends minimum credentials for counselors assisting patients with gender dysphoria. These minimum criteria include a master's degree, clinical behavioral science field, compliance in using the Diagnostic Statistical Manual, that's the DSM that we talk about often, of mental disorders, and an international classification of diseases for diagnostic purposes. The ability to recognize and disclose a coexisting mental health concerns and to distinguish those from gender dysphoria. Documented supervised training and complete in psychotherapy or counseling. Knowledgeable about gender non-conforming identities and expressions. And the assessment and treatment of gender dysphoria, continuing education in the assessment and treatment of gender dysphoria, and for counselors working with children and adolescents trained in childhood and adolescent developmental, psychological, or psychopathy. Oh my gosh. Psychopathology and competent in diagnosing and treating ordinary problems of children and adolescents. She didn't have that. So there's somebody writing letters to recommend things that doesn't have that. And it goes into that. So, and that was in November 21st of 2016. The defendant Klein Fowler did not state that she met any of these criteria. After her name on her signature line, she listed the following letters: the M period ED and NCC and LPC. She did not list any credentials or title relating to gender dysphoria or transgender health. So her lack of qualification, she proceeded to write a letter representing Prisha falsely as an excellent candidate for a mastectomy surgery and aid her in her medical transition. She didn't even have the background to do this. Like, that's just astonishing to me. Like, how does this happen? Despite Prisha's documented history and mental health problems and ongoing struggles with anxiety, including just a few days before, on November 17th, when discussing the prospect of surgery, Klein Fowler misrepresented Prisha's conditions as presenting no apparent residual psychiatric symptoms and quite stable. So there's a lot of misrepresentation that happens over and over and over again through this. So Klein Fowler concluded that Prisha met and exceeded the criteria as set forth by WPATH, which she did not state what those criteria were. So, for instance, WPATH SOC 7 provides tasks related to assessment and referrals, including gender dysphoria, provide information regarding options for gender identity and expression and possible medical interventions, diagnose and discuss treatment options for coexisting medical health concerns. And she didn't state she had completed any of these tasks. Under the task assessment eligibility, prepare and refer for surgery, SOC 7 lists recommended content of the referral letters for surgery, including, among other things, results the client's psychosocial assessment, including any diagnosis, an explanation, the criteria for surgery, have been met, and a brief description of the clinical rationale for supporting the patient's request for surgery. So a statement about the fact that it involved consent, consent has been obtained from the patient. She didn't include those things in the November 21st, 2016 letter. She didn't disclose Prisha's numerous mental health issues and the diagnosis that she had. She didn't explain that criteria for she did not explain that the criteria for surgery were met, other than proclaiming that they were. So there's like a lot of procedures that are supposed to happen in order, like there are things that are supposed to, supposedly supposed to be safeguards to help make sure that these things don't happen or they happen the right way, and at least the people that are writing the letters know what they're talking about. And these safeguards, they were completely ignored. Like, how do you have informed consent? It's absolutely heartbreaking what happens to this young lady. And, I feel like society has failed her. And these detransitioners need to have their voices heard. They deserve it. So the WPATH SOC 7 also provides criteria for mastectomy and creation of a male chest, which includes persistent, well-documented gender dysphoria, capacity to make a fully informed decision and consent for treatment, and the majority in a age of majority in a given country. If significant medical or mental health concerns are present, they must be reasonably well controlled. And it's outlined over and over and again in this that it's not controlled. It's not in any form controlled. So it's not identified these criteria in the letter, much less explain how Prisha supposedly met each one of them in light of her diminished capacity, vulnerable state, and ongoing mental health challenges. I mean, how do these people sleep at night knowing that this is what they're doing? I mean, and it's not just a couple of them. I'm going to take a moment from reading this. I'm going to stop sharing this. I'm going to pull up a video and I'm going to play that. This is some of the testimony from her, from Prisha herself. And let's just get this up here. And this is the Texas bill that she testified on. So I'm going to go ahead and mute down here. I'm going to add this. And we're going to play a little bit of this. I had to give my eyes a little bit of a break from reading.
And sterilize their child. I don't, but thank you.
I understand.
My name is Prisha Mosley. I was a 15-year-old girl when the trans community found me. Already diagnosed with multiple mental illnesses, including anorexia, a body dysmorphic disorder, and borderline personality disorder, a trauma disorder, I was easy to manipulate and convince that I had been born in the wrong body. I was told that this was the reason for all of my mental and emotional distress. I was told that changing my gender would cure me. As an impressionable and mentally ill child, I fully believed this. I also believed that my sexual assault, which happened at age 14, only happened to girls. I wanted to transition to be safe, and I was allowed to make permanent changes to my health due to these beliefs. Beginning at 17, high doses of testosterone were injected into my anorexic body. This was done by a pediatrician in the same hospital where I was seeing a nutritionist for my severe malnutritionist and regularly receiving stitches for cutting and other self-harming behavior. What I don't understand is why they never offered me counseling to help me with the depression, the trauma, the personality disorder, or my ongoing self-harm. It was clear that they were solely focused on pushing me into transition without any regard for all of the other clear challenges and issues I was experiencing. Testosterone had extreme side effects, more and more of which I am discovering every day. I suffered hair growth all over my body and hair loss on my head. My shoulders rapidly broadened beyond my frame, causing me to be disproportionate, clumsy, and in pain. My neck, back, and shoulders constantly burn, and all of my joints ache all of the time. Testosterone also caused changes in my vocal cords and throat. I can no longer sing or really raise my voice, and speaking for long periods of time causes me pain. My endocrine system is ruined, and I'm no longer able to regulate my own hormones. I have no choice but to be medicated for this for the rest of my life. One of the worst side effects has been vaginal atrophy. This is the shrinking and thinning of the vagina. It is so severe that I am no longer able to use tampons because it is so small, and I'm afraid that I will tear. This has happened before. 1 year after starting wrong sex hormones, despite persistent self-harm, my healthy breasts were removed. I was told I would have sensation in my chest within 1 year.
Instead, my chest is numb except for the occasional zapping pain. I almost lost my nipples. After being grafted, pieces of them stuck to my bandage and fell off, and I no longer have them. During the time in which I was receiving gender-affirming care, my psychiatrists and psychologists had to ask me at the beginning of each appointment what my name was, who the president was, and what year it was, because I was so far from reality. They told me no to liposuction and yes to a radical double mastectomy. I was too unhealthy to consent to lipo, but not to top surgery. I was convinced that my puberty was a disease, and I trusted my doctors and the trans community when they told me they had the cure. But it wasn't true. I stand now before you in an aching body, which is no longer mine. I don't recognize myself when I look in the mirror. I am suffering from severe medical issues with which no doctors will help me, and insurance covers nothing. The medical professionals who did this to me have abandoned me, and the trans community has abandoned me. My doctors assisted me in mutilating myself and then left me in the cold when I wanted the harm to stop. But when I see young girls in my situation, young girls who have experienced sexual trauma, who are suffering from mental illness, and who suffer from body dysmorphia disorders, or who feel pressured by social media or their peers to conform to certain stereotypes of femininity, my heart breaks for them. And while the damage done to my body can never be fully reversed, I can be an advocate for those girls in the same position I was. Thank you.
Thank you for your testimony. Thank you for sharing your experience with us. Committee members, any questions? Senator Campbell, do you have questions?
Thank you. Prisha, thank you so much. You flew down from where?
Michigan.
So members and people watching, Prisha came from Michigan to try to take what has happened to her and help others. She has been abandoned. You can bet everybody was on board to help when she was transitioning. And somebody can speak to the cost. Can you speak to the cost of the dollars that you think insurance put out for all the transitioning?
Insurance paid for the testosterone and all of the blood tests and all of the appointments. It had to be thousands.
Thousands. And today, you were how old, if you don't mind me asking, 26?
25.
25. And you do have insurance? Or you do not?
Yes, and they will cover nothing.
So while insurance paid thousands upon thousands, and just in 2021, just the surgery alone cost, just the surgery market cost raked in $1.9 billion. But that's going forward. Who's taking care of the people if they decide to go backwards? Who's there for their detransitioning? Nobody. So whether you agree that they did it or not, the insurance companies paid, and the people doing it took the money. Now that she's made this decision to detransition, nobody is there. How is that ethical? I ask each of you to think about that. Now, let me get to a question. Tell me about your hormone predicament, because if you're not getting care, you've sought care, you're not getting care. What are you doing about hormone therapy?
After finally getting my doctor to get a blood test, which she ordered in the male range for some reason, but we finally got it straightened out and figured out that I'm just not producing my own hormones after years of testosterone abuse. And no, she won't prescribe it. She said, I know what you need, I know what dose you need, and I'm not willing to treat you like a guinea pig. So now I'm treating myself with herbs, trying.
Okay. And when you were getting hormones, you had to have blood tests frequently, didn't you?
Yes.
Right. Yet now that you're off, they've abandoned you.
Yes.
Were you told you would be in chronic pain? I understand you're in chronic pain. That's how you described it.
I was not warned anything about the chronic pain. I have joint pain and my body burns and my pain tolerance is lower.
Is that because you're detransitioning?
Yes, it is due to the testosterone abuse.
All right. Prisha, can you tell me, why did you decide to detransition, if you don't mind? How'd you come to that decision? I think if you're willing to say that, we need to hear, because I don't know.
So I got into a type of trauma therapy called dialectical behavioral therapy, which helps with extreme emotions, emotional regulation, and black and white thinking. And all of the magic that was supposed to happen when I transitioned, like the healing and the euphoria, all happened through actually healing my trauma.
By actually what? I'm sorry?
Healing my trauma.
Oh, so that therapy helped you heal the trauma that you had as you started your testimony, you had prior to the surgery. So after you had surgery, you then found the right counseling that got to the root of the problem. So the arrow was shot at the right target, but after you transitioned.
Yes.
Thank you. Thank you so much, Prisha.
Senator Menendez.
Thank you, Mr. Chairman. Ms. Mosley, thank you for coming today. In your testimony, you mentioned that you were suffering from quite a few things. You said depression. I forget, could you remind me the things that you were going through?
Anorexia and borderline personality disorder too.
So you were going through borderline personality disorder, anorexia, and depression. What age do you recall going through these things?
I got my medical records back and they predated it to the age of 12. It was like right onset with puberty.
Okay, right around 12. And so maybe that's why someone gave you a diagnosis. Do you recall who made the diagnosis or who told you that if you transitioned that things would get magically better?
Yes, it was my gender affirming therapist that the trans community told me to find to get a letter of recommendation. That's the key you get that unlocks any hormone and surgery you want. And then the therapist that I was seeing prior to coming out as trans just said that all of my problems would go away, which she had been seeing me for years when I transitioned. Everything was somehow related to being trans.
And you were 12 at the time?
I started serious therapy at 12.
12. And your parents, what did your parents say about this?
My parents were really against it, but I mean, I remember my gender therapist looking him in the eyes and asking, would you rather have a dead daughter or a living son? Do you want to pick up her hormones or her body from the morgue? Those were the only two options given.
How did you end up at this therapist? Who picked them?
I found her myself. I Googled therapists who did gender affirming care.
So at 12, you Googled a therapist that did gender affirming care. So
at 15, I started socially transitioning at 15. 12 was when the prior diagnoses of anorexia, borderline, and depression and all that came.
And so when you were having the issues of depression and borderline personality disorder and anorexia, did your parents get you help for that?
Yes, but their treatment-resistant conditions, especially finding DBT is difficult. There's a lot of stigma against borderlines. It was much harder to find that treatment than trans care.
So it sounds like to me that you had other diagnoses, you couldn't find the right care, and so what you've testified here is that someone said to you, if you do this, this will help, and then in a way they sort of blackmailed your parents is what you're saying. So it doesn't sound like this was either your decision or your parents' decision, because my concern is not, I don't want anyone to go through what you've gone through. But what I don't want is either for parents who have children who this has been, they've known from a young age that this is what they are. And we're taking that from them because I don't want them to go through what you're going through. I think that this bill will potentially cause someone to be in a position where they're as unhappy as you are. And I'd hate that for that to happen to anybody. Thank you for coming today, and thank you for sharing your testimony.
Am I allowed to comment on that?
Of course.
Okay, also, thank you and you're welcome. But I don't believe that any parent has the right to mutilate and sterilize their child. I don't, but thank you.
I understand.
There, you get gynecomastia, so the males are developing breasts. Those are not going to go away when we stop the hormones. The females can develop a micropenis. It's not going to go away. The micropenis grows from the clitoris, meaning that this area is incredibly sensitive to them. So there are cases where they have to wear certain clothes in order to not irritate it constantly. And this is a lifelong thing. It's not going to go away.
I don't believe that any parent has the right to mutilate and sterilize their child. I don't, but thank you.
I understand.
My name is Prisha Mosley. I was a 15-year-old girl when the trans community found me.
So with every bit that you hear more of the story, you get more of these pieces together and you hear like, as a parent, I don't know what I would have done. I can't it would be great in hindsight. It's really easy to judge somebody from the outside, but all I know is that as a parent, if the doctors were telling me that, if I didn't do something, if I didn't affirm my daughter, that she would die, I don't know what I would have done in that situation. I honestly, right now, knowing what I know now, with all the information that I know about this, I would absolutely say no. But would I have without all this information? Would I have said no? I honestly, I don't know. So that's just like me being honest about it. I might have listened to the doctors. I might have gotten fooled by them in the same way. I don't know that I would or I wouldn't have. And I can't really judge that because now I do have the information and that didn't happen. It would be a hypothetical thing that if it did happen. But at the same time, I can absolutely say that, there's a lot of things that will rock your world as a parent. And hearing that your kid might not make it or your kid might kill themselves, that would rock any parent to their core. And unless we're in that situation and we've heard that, and this is something I've heard from a lot of detransitioners, I've heard it from trans rights activists, that if they aren't affirmed, they're just going to kill themselves. I've heard it from medical professionals. It's on loop. They say it over and over to everybody. Like, how is that a care? How is that care saying, well, if you don't do this, then this is going to be the outcome? It's wild to me. It's inappropriate on so many levels that anybody would say that to somebody. That they would just skip treatment. Like she says, I found out after I did all this, after this surgery for a mental health condition. She wanted to get liposuction and they wouldn't give it to her. because she was actively starving herself. They wouldn't give her liposuction. But they gave her a double mastectomy and testosterone. That doesn't make sense to me. If you're not outraged by this, then I don't know. I don't know. Maybe you're not paying attention to what we're talking about. Because I am outraged that this is happening to young people. I mean, it just breaks my heart. Exactly, Wes. Exactly. She asked her doctor if liposuction was right for her, and they said, definitely not. But here, buy this. Yeah. And the detransitioners need the support. They don't need you to love bomb them the way that the trans community did, but they just need support, and they need to know that people believe them. I mean, she has the proof. She has the emails back and forth. And then some of these places have even told her that she wasn't even a patient there. But she certainly has emails from them. They're trying to erase her. So I'm going to go into more of the court documents. I have to flip off the screen. I can't stay on the screen where I can see the chat while I'm doing this because it's too small. So let me see here. So we were talking about this in the court documents before I played the clip. It was about the point where they're getting the letters for her to get this top surgery, to have this drastic breast removal. She has to have a WPATH letter. So it says Prisha supported fitness for drastic breast. Okay. The defendant, Klein Fowler, misrepresented Prisha's supposed fitness for drastic breast removal surgery and decided Prisha into thinking that surgery was necessary and appropriate. Like, who does that? Klein Fowler also have deceived a surgeon, defendant Dr. Emerson, in certain respects, as a letter was placed in Prisha's surgical file. So the letter that was already misrepresented and she concealed that she didn't have the credentials that she needed at the time. That was also used to have the surgeon perform a double mastectomy on a young girl. See how that domino falls? So Prisha didn't discover defendant Klein Fowler's misrepresentations, concealment, and wrongdoings until recently, within the last year. And she could not have discovered it prior to that time. in the exercise of reasonable diligence because she was vulnerable and suffered from a host of mental health issues. She was under Kleinfahler's influence and trusted Kleinfahler to take care of her. And she relied and believed Klein as an authority figure. Likewise, Prisha was under a disability, was incompetent, and lacked capacity to discover the wrongdoings earlier because Prisha lacked significant capacity to manage her own affairs in this regard. And her host of mental health illnesses, including borderline personality disorder, caused her to lack significant capacity to exercise her legal rights or make communicative important decisions concerning her person. Those mental health issues, illnesses, or similar conditions cause her to repress from her memory or disassociate, akin to repression and wrongful acts that Klein, until Prisha recently underwent therapy, which began to uncover some of those past events in her mind and eventually helped her realize the wrongdoing occurred and the appropriate care was not provided. So because of this, she has suffered emotional distress, as you can just imagine. So they completely knew, based on her medical records, they completely outline it in the beginning of these court documents over and over and over again, how they are continuing to assess her, and how it gets worse. And it gets worse after she transitions. So November 29th, 2016. So she attends a preoperative appointment with the defendant, Dr. Emerson, according to the records produced in response to the request prior to filing the case. This was the first time Prisha and Dr. Emerson after the initial consultation on January 13th, 2016. So from January, this is where I was earlier, and I rewound back to get give you guys some more information. So January 13th, 2016 to November 29th of 2016. So that all that time goes by. So after the initial consultation, they didn't perform a second consultation prior to the preoperative appointment. So November 29th, preoperative appointment, Prisha appeared to sign an informed consent document that the defendant Piedmont Plastic Surgery and Dermatology PA provided. The document states, I hereby authorize Dr. Gregory Swank and such assistants to may be selected to perform reduction mammoplasty surgery. Now, that's the kind of surgery the doctors talked about giving me because of my back. That's a reduction. But that's not what this is. That's not what happened. There does not appear to be any consent document authorizing Dr. Emerson to perform surgery on Prisha. So additionally, the informed consent documents indicated that the procedure would be performed was a breast reduction designed for women who have large breasts. As a result, experience back, neck, and shoulder and skin irritation. This was not an accurate reflection of Prisha's situation.
Let me know if you like it.
So a double mastectomy is not the same thing as a breast reduction surgery. Another thing that they did. So the informed consent document said that the patient may have more difficulty breastfeeding after this operation. The document also stated that pregnancy could cause the breast skin to stretch and offset and result in surgery. If it did not state breastfeeding would be impossible. So at this point, this informed consent document is stating that she might have difficulty breastfeeding. And that it's just a breast reduction. So the details of this case really do matter. When you look at it from the outside and you're just like, oh, well, she was 18 and this and that. No, there's a lot more to this. The informed consent was not there. The informed consent documents do not state that the surgery would be irreversible and permanent. I've referenced above, defendant Kleinfowler's letter appears in Prisha's surgical file, but Dr. Emerson did not note any discussion of WPATH standards or guidelines or assessment of Prisha's candidacy for surgery with respect to such standards or guidelines. Dr. Emerson did not perform an independent assessment of Prisha's fitness for surgery. Despite the WPATH statement that says health professionals who recommend surgery share the ethical and legal responsibility for the decision with the surgeon. So it says that. It's all outlined. It's really crazy when you get into the nuts and bolts of this case. Like, that's what really hit me. It's like I read the article and I had compassion and care for her already, and had been in contact with her, you know. But when I started to read the details in this case, I was absolutely floored. How over and over and over again along the entire way, they were failing her on this path. And everybody was just, yep, okay, we'll just sign it off. We'll just keep doing it. Like, how many red flags do there need to be? So on or about December 8th, 2016, Dr. Emerson surgically removed Prisha's breast. Dr. Emerson notes that indicate that Prisha's nipples were severed and reattached. As a result of the surgery Dr. Emerson performed, Prisha was unable to nurse a child, and she has suffered and expects to continue to suffer severe physical pain and psychological and emotional anguish. Each of the defendants owes a fiduciary duty. Owed a fiduciary duty to Prisha. They misled her. They misled Prisha into charges and to changes to make her body, make it look more like a boy's body. The defendants did this to benefit themselves financially by receiving money for so-called treatment they imposed on Prisha, and to build up and enhance their respective reputations as providers for gender-affirming care. So, you know, just like as if it doesn't feel like it can get worse, that the manipulation that these people have done this whole time. For example, around July 15th, when she met with Prisha briefly, defendant Gordon held herself out in her bio at the Tree of Life Counseling PLLC website as a transgender specialist for children, adolescents, and adults. But there was no mention of WPATH in her bio. After meeting Prisha, Gordon amended her bio to show, as of around March 2016, she was engaged in evaluations for cross-sex hormones and gender reassignment surgery, currently working towards the WPATH certification. So this just shows that this is afterwards. After she does this, then she gets going towards her WPASS certification. She didn't have it before. She shouldn't have done what she did. She showed that she'll play ball. And then in June, so what was that? That was March. She said that she's engaged in it. And then in June of 2022, Gordon held herself out as a WPATH GEI certified gender specialist. Similarly, Dr. Perry holds herself out as providing gender affirming care to adolescents. See how that worked? So they didn't have it before. They pushed Prisha through, but now they do. They showed that they showed that they can play ball. I know what to do. Before operating on Prisha, Dr. Emerson indicated that to her that he was eager to break into gender affirming care field and perform such surgeries, and that hers would be his first. After operating on Prisha, Dr. Emerson became a founding member of Charlotte Transgender Healthcare Group, and upon information and belief received reputational benefit and referrals for surgery as a result to performing top surgery on Prisha. What does it sound like? I mean, to me, it sounds like they colluded to use her to get these titles so they could do it to more kids, more young people, take advantage of more people. This isn't just like, oh, somebody made a bad decision. No, there were people working actively against somebody who was in a very vulnerable state. And all those red flags were ignored. The parents were cast aside. This is the solution. This is the magical solution.
Magical solution.
As alleged in the complaint, the jury demanded a relation of trust and confidence was created between each of the defendants and Prisha. Each defendant took advantage of that position to trust Prisha's to Prisha's detriment by misleading her into changing her body to look more like a boy's body, and in the process incurring significant injuries and a huge expense for the defendant's services, and dealing with the detrimental effects defendants cause for the rest of her life. It's absolutely heartbreaking. And this is just like the tip of the iceberg of what they've done.
Yep.
This is going to affect the rest of her life. They took a vulnerable person before they were even 18 years old. Even at 18, your brain's not fully developed.
I think fundamentally that's the problem with the whole thing, is that there's a mechanism in place for people to do this to children before they're able to make any sort of rational decision, and then be coaxed into things that they wouldn't otherwise choose for themselves or think.
I mean, what would
there
you
were options. Like, that's just, it's fucking heinous.
What would you think as a parent if you go to a doctor's appointment or you're, like out in California, they're literally taking parents, like they're taking the kids away from parents that don't decide to do this care to their kids.
Uh-huh.
So imagine, suddenly you get the shock. They're hiding it at schools. They're hiding this from parents at schools, saying that these parents might be dangerous. I think that the people that are dangerous are the ones doing this.
Yeah, the ones that are hiding it and the ones that are coercing children into doing things that they inevitably probably will regret. And maybe one out of 1,000 of those kids doesn't regret it. And that's exactly the thing that's needed. But it should be discussed. It should be something that doesn't actually happen until that person
they need to go through natural puberty.
Yeah, until that person is old enough to have completed puberty, first of all, and see if they still feel that way. I don't think it's like beyond reasonable to offer that gender affirming thing to kids who seem like they might need it, but it should go no further than like actual therapies and actual time to topically transition or whatever the course of action is, and just explore all the different opportunities and all the different options all the way through puberty until that child is 19, 18 years old, whatever, somewhere around there, to begin to make those decisions to do things that they probably shouldn't be allowed to do until they're actually adults.
Well, Transsexual Unity, which if you are on Twitter, I suggest that you find them and follow them. Transsexual Unity, Buck Angel's in it. A friend of mine, Laura's in it. Some really awesome people. They do Twitter Spaces, and they talk about how there used to be a process for transsexuals, and they went through that process where you had to go through years of counseling first, and then you lived as the opposite gender, and then the whole process thing, it would take until you, even if you started right at 18, it would take until you were 25 in order to have it done, to finish it. And they say that no one should be having surgeries before the age of 25 when your brain is fully developed. And I support there being some kind of safeguard, because this has now become a social contagion. When entire friend groups, and it's trending to all go at once, and it's up a 5,000% increase. This started in 2015. Now remember how long ago this was.
That's 8 years.
What's going to happen in 5 years?
Just in case anybody didn't know.
What's going to happen in 8 years?
Well, 5 years, they just...
Or even, 5, 8, 10 years. What's going to happen?
Didn't they just say in 5 years that this industry itself would be in the billions of dollars? Right now, it's only making millions of dollars because there's only so many. But the trajectory as it's growing, 4,000, 5,000% in 5 years, that's going to be a multi-billion-dollar industry. And then how are you going to slow it down then? How are you going to say, hey, this isn't right, don't do this to kids, if it's just standard practice? Well, we give everybody a lobotomy. That's just the way it is. If you have a seizure, then you get a lobotomy. If you think you're a girl, then hey, and you're a boy, well, you got to have the lobotomy, or whatever the equivalent is in this situation.
Thank you, Courtney.
They're trying to normalize
the super
it.
sticker. We appreciate that. I really appreciate any of the support that we get. It really, really means a lot to us. I mean, yeah, I think we're going to look back at this. It's going to be just like the lobotomy, just like other things where there has been cases of this happening. We're going to be talking to somebody who works in the clinical field tomorrow. So not specifically for this, but a detransitioner is coming on the show tomorrow. So I hope you guys will tune in tomorrow as well, if you're here tonight, because this is really important. Their lives matter, and what's happening to them is not okay in any way. And these, young ladies and young men that have detransitioned are getting attacked. They're suddenly like, oh, they were never trans. But they were trans when this was happening.
Right. It's like you said, we were trans and then we were trans and then now we're not. What?
Yeah, because once you leave it, it's a cult. Once you leave it,
Yeah.
it's a problem.
There's a lot of that, you know?
And and there's a difference between transsexual and transgender. And we need to remember that. I'm actually going to be having an upcoming guest that is a transsexual. I know that you probably watched I had Buck Angel on before, and Buck Angel is a very outspoken transsexual. But I am having a transsexual female come on the show coming up soon too as well. I have I'm booking a lot of really interesting guests to talk with you guys. All right, so back to this. Upon information and belief, the defendants conspired together to mislead Prisha into changes to her body to make her look like a boy's body. I mean, they really had her under the impression that she was going to grow a penis with testosterone.
Yep.
Does that sound like somebody who's in the right state of mind? And I deal with my own mental health stuff, so I'm not making fun of her for that at all. I just want to make that clear. I can't imagine everything that her and her parents have gone through and what she continues to go through, and the guilt that they must feel. I mean, it's got to be really hard for everybody involved. And this is just one case. There's thousands that we know of. And they're not actually like reaching out to the detransitioner. It's like they're like, no, that's not my patient anymore. They shut them out. There's more and more detransitioners coming out like every day. And there's more lawsuits being filed. And I think that is what is going to change things. The lawsuits. Well, they're held accountable for this. I mean, I had somebody on Twitter earlier telling me that no minors have had sexual reassignment surgery. And I'm like,
Meanwhile, they have
Jazz Jennings is on national television on TLC and had it at 17. Actually had to have 4 surgeries, bottom surgeries, because of the complications and everything that happened. All on national television. Jazz doesn't appear to be doing very well either. So, all right, let me get back to this court document. So, for instance, the defendants Gordon and Dr. Perry conspired to mislead Prisha into taking testosterone, with Gordon writing a letter of recommendation for the prescription, and Dr. Perry writing a prescription. Similarity. Defendants Gordon, Klein, Fowler, and Dr. Emerson conspired to mislead Prisha into surgery, with Gordon, Klein, Fowler, and Dr. Emerson promoting the surgery, Klein, Fowler writing the letters and the recommendation, and Dr. Emerson performing the surgery. Each of the defendants, Dr. Emerson's actions, misrepresentations, all of it. It's absolutely like ridiculous. They all conspired to do this. So there's several counts that have been filed. So it goes into to say each of the defendants misrepresented to Prisha that she was actually a boy, and that changing her body to look like a boy would solve her psychological and mental health problems. She thought that injecting testosterone into her body would solve her mental health issues. They misrepresented her to have breast surgery and it would solve her psychological and mental health problems. They misrepresented the nature of the effects of breast reduction surgery, which actually was a surgery to remove her healthy breasts and render her incapable of nursing a child. So they misrepresented even the surgery that she had. The defendants omitted, withheld, and suppressed critical information from her about the long-term adverse health consequences and permanent damage these purported treatments would cause her, and they failed to inform her of an alternative courses of treatment for her psychological problems and ensure that she had clear understanding of those alternatives. If you saw in the last video, she said that she's not even getting hormones anymore. They won't give her what she needs. Like, they've all turned their back on her. On February 22nd, 2015, Perry misrepresented to Prisha that it was illegal for her parents to be involved in decision-making regarding whether she would undergo medicalization gender transition. They made her think that it was illegal for her parents to be involved. At least as of on March 6, 2015, the continuing through 2015, 2016, 2017, and continuing thereafter, Dr. Perry deceived Prisha, misrepresented her medical condition, and withheld her from the true facts regarding the so-called medical transition. I mean, I can't imagine, like, can you imagine going through therapy and then finding out, like, everything that you were doing that you thought was your treatment, that these doctors had your back, that they were working as a team? I mean, that makes it even worse. You know what I mean? Because it's like, oh, well, they're affirming each other as they're affirming her. So she's in like a complete controlled environment, echo chamber of all these doctors that she's like listening to, thinking that like she's getting help and treatment, and they're in fact doing her harm.
Yeah.
Together. I mean, why would they withhold her, like, you know, from getting proper treatment so that they could manipulate her? Like, did they conspire this to do this? Like, what is happening here? So they withhold her alternatives to medicalized transition, such as counseling, by withholding pertinent information such as scientific evidence and basis and lack thereof pertaining to medicalization transition. So she thought that these testosterone injections were just, that's what she had to do. They were medically necessary. They didn't inform her that taking testosterone causes vaginal atrophy, which is very painful, inability to have intercourse, an enlarged clitoris, permanent voice change, pain in the shoulders, the neck, the vaginal area, and fertility impacts. Like, she has to deal with this for the rest of her life because these people colluded against her that were medical professionals, that are medical professionals. I wonder how many people they've treated since they figured out the system. This isn't going to be the end of these cases.
Oh, this is just the beginning.
This is just the tip of the iceberg. I think that hers was, the third one. So there's others, and there's another one I said earlier that I saw came out today, and I haven't had a chance to verify it. You know what I mean, with the person. And if I can, I don't know if I can, but I will try. So they had misrepresented that the WPATH SOC 7 guidelines, requirements, the criteria had been followed, and they were satisfied with respect to Prisha, that Prisha was she was an appropriate candidate for cross-sex hormone therapy. They didn't make full and accurate disclosure to Prisha that the supposed benefits and risk of cross-hormone therapy. At least as of July 2015 and continuing through to 2017, continuing thereafter, Dr. Perry further misrepresentations and concealment that concealed Prisha's ongoing use of possible toxic medication. I can't believe that there's money that would make people do this, or title, I guess, which would bring them more money. And this is just one small group. These gender affirming clinics are everywhere. How many kids are they seeing? How many kids have gotten this same treatment? On or about July 23rd, 2015, and previous times and thereafter, Dr. Perry misrepresented Prisha that she was undergoing male puberty, and she would have symptoms of male puberty, and she would grow a penis. January 7, 2016, and previous times and thereafter, defendant Klein Fowler suppressed the fact that Prisha was struggling with impaired daily functioning and misrepresented that she was an appropriate candidate for so-called top surgery. Have a double radical mastectomy. They misrepresented to Prisha that surgery on her healthy breast would benefit her and that she needed the surgery. At the time, Emerson concealed the detrimental effects such surgery would have, such as the loss of Prisha's breast, loss of ability to nurse a child, and the physical and the psychological pain. She has something called phantom breasts. Just like, if somebody, if somebody loses a limb, they'll have the phantom pain. Same thing. April 13, 2016, in previous times and thereafter, Dr. Perry misrepresented to Prisha that her estrogen was nicely suppressed and that her testosterone level was in a range he would like. The range we would like. I'm sorry. Misleading Prisha into believing that these levels were healthy and medically necessary and appropriate. So they go on in this to continue to outline all of the different ways, every piece by piece by piece. How the doctor misrepresented that they weren't, that they didn't actually meet the criteria to even give the letter for mastectomy surgery. Like, how does that fly? How did this many people fail a person? You're either incompetent and you shouldn't be doing it, or you did it on purpose and then you shouldn't be practicing either way. I mean, how many people can fail one person? They performed a surgery that was, misrepresented as a procedure that was performed as breast reduction. It wasn't that. They misrepresented the actual surgery that they even gave her. They put in the notes that they, quote, may have more difficulty breastfeeding after this operation. And that pregnancy could cause the skin to stretch and offset the results of surgery. That breastfeeding would not be impossible for Prisha after surgery. Like, how awful is that? She thought you were giving her the cure. This isn't a case of just somebody made a decision over 18 to go get something done. They deceived her on purpose. This is complete manipulation.
Would appear so.
I can't imagine how her parents feel about this. I mean, it's always easier to look back in hindsight at things, right? And we can judge ourselves in hindsight, but I can't imagine how they feel. And I'm not blaming them. I'm saying that they were manipulated as well. But I'm sure that there's always just going to be some self-doubt, and just, I know I would have it.
Yeah.
I mean, how many parents are going to, I mean, like she said in the other video, you put so much into it, all this money, all this time, all these doctors, and then to to reverse course after all of that. That's gotta be so hard.
It's got to be even harder when the things that you're doing are harming you along the way, and then you reverse course. Like, you've already, instead of just changing and making a transition into something new, you hurt yourself the whole time.
Sorry. Yep. There was a point in this I wanted to. But yeah, I know. After everything happens, it's like I can't imagine clip here I wanted to play. So I want this to play it. Okay. I'm going to bring down the Daily Mail. I want to play this. This is more testimony. And this is the Ohio bill, the SB 68. And this is from April. Let me add this here. I'm going to mute.
We'll start the questioning with Ranking Member Liston.
Thank you, Chairman. Thank you for sharing your story. I'm sorry for all of the pain that you've been going through. I do want to just poke a little bit about one portion of the story so that I can make sure I understand the process and how it relates to the law. You talked about experiencing some of the social transitions younger and then seeking out hormones at 17. But what you're describing to me, I want to clarify the time frame because, in Ohio, you can't get medications without consent before 18. You can't get hormone treatments without consent before 18. So just to clarify, when you actually started testosterone, that was on your consent after you were 18.
I started testosterone at 17. Top surgery was 18.
Okay, and so for the treatments then, were you with family at that time? Did they consent with that? Or was that alone on your own choice?
I brought my family along and I was in the room when my doctor looked at them and said, would you rather have a dead daughter or a living son? Do you want to pick up her hormones or her body from the morgue?
Okay. So at that time, your family consented to the beginning and then you did so at the end. All right, and it does sound that you had a lot of emotional strife at that time. You were receiving other support therapy for the anorexia and other counselors, or no? Or was this?
Yes, I was seeing a nutritionist and several therapists from the state as well as private therapists. And in my letter of recommendation for surgery, my therapist even said that all of my pre-existing problems existed because I was born in the wrong body.
Okay. And then final question, how long were you on testosterone, just to get a sense of that?
5 or 6 years.
Okay. All right. Thank you.
We'll continue questioning with Representative Stewart.
Thank you for being here. Thank you for your testimony. It's very important, and I appreciate you stepping up to tell your story. If you haven't, that's okay. But I guess I'm just curious. Have you had any conversations with some of the physicians that were a part of your transition services? Have you expressed any of these folks your regret over the services you received? And if so, are you able to share any of what their response would be?
So I reached out to that gender therapist and my old therapists and stuff, and my gender therapist said there's no record of me going there. They're literally gaslighting me and ghosting me. My parents even sent in like a notarized, legally binding thing just to get my records and talk to them. And I have emails going back and forth between this person. I'm sure I went there. And they said I never went there. They're literally saying I don't exist.
Representative Samani.
Just one question. Do you know if testosterone's effects are irreversible, reversible, or if some of the effects are reversible and some are irreversible?
I have never seen anyone recover from using testosterone. Your body can't re-shrink. My genitals won't unatrophy. I'm never going back to the way I used to be. I don't know any part of it that's reversible.
Do you know that testosterone has been used in the past for the treatment of endometriosis and also has been used for other medical conditions?
Yes, I am aware of that.
X.
Testosterone is not FDA approved for use in women, and trans identifying people are given incredibly high doses to match the male body. And I actually I told my therapist that I wanted to look different fast and was given a very high dose.
So unfortunately, in the same vein, trans women also have some of the same issues. You know, is that something that they should be forced to suffer from?
Can you clarify a little bit?
So trans women also, you know, have hormones, are given hormones that change their testosterone levels. Is that appropriate or not appropriate?
Puberty is natural and a rite of passage for becoming an adult, and I don't think that anyone deserves to be sterilized to avoid that.
What age do people usually go through puberty?
Like early teenagerdom, maybe a little earlier than that.
So yeah, the average age for women is 9 to 11.
Okay.
Thanks. Thank you.
Representative Stewart.
I don't understand why she even asked that question and why she was asking the other ones. They were not like specifically relevant to what Prisha was there to testify about, as far as I, you know what I mean, could tell. It just seemed like she was just trying to have like no, but I want to like approve this. So I need to like catch you in something so that I can hang on to something to use it so that I can vote the way that I already came here with the intention of.
Yeah, that seemed really grimy.
Mm-hmm.
That was just an attempt at narrative spin. That's all.
Oh, yeah. Yeah. Say something wrong. I'm sorry. I don't know. Usually females aren't going through puberty at 9. Like they're not like having their period at 9. They might start some symptoms or whatever. But like, you know, even 11 is young.
And it absolutely, but it all varies wildly. You know what I mean? It's not, there's no set.
The early, yeah, I was 12 when I first got my period. So
that's what I'm saying. It can happen a lot sooner. It can happen later.
Yeah, it depends. Actually, they say to look at your mom, and when your mom got it is usually when like they say you're gonna get it.
Yeah.
All right, I'm gonna play this again.
Representative King.
Thank you, Mr. Chairman. Thank you for being here with us today and sharing your personal story. You're very brave and courageous, and I thank you for that. And I would ask you to continue sharing your story with others. I do have a question. I'm curious to know what kind of consent or therapy you or your family may have received prior to your surgery. I'm a parent of 2 children who are hearing impaired. And when my youngest was 3, she had hearing aids. And the hearing aids no longer worked for her, and cochlear implant was the only option. And before we could schedule the surgery for a cochlear implant, we were required, my husband and I, to meet with a therapist or a psychologist or somebody within their team to meet with them and be evaluated, to see whether we would have the commitment to help our daughter adjust to the cochlear implant, speech and language, and everything that's required. Were you given that same opportunity, or you or your family, was that discussed with you, whether there would be permanent damage, how this might impact infertility, loss of sexual function, or the lifetime commitment to hormones or therapy? What kind of intervention prior to scheduling surgery were you given?
I had one short appointment with my surgeon before I saw him, but I just got my letter. And when I had that letter, he didn't question anything I said. One thing, I was told I would have sensation in my chest in about a year, and it's been 7 years, and I continue to be numb, except I have like occasional zapping pain that's like nerve damage going across my chest. I was given informed consent for hormones, but I was told I wasn't able to give conformed consent for liposuction because I was too unwell. I had gotten out of the hospital like 2 weeks prior to this for trying to die.
Thank you.
Representative Byrd.
Thank you, Chair. Appreciate your testimony here. We've already heard the term gender affirming care used in this committee already today. Want to know what you think about that term, gender affirming care. Do you see it that way?
I think it's gender denying harm. You are denying your birth gender and taking experimental sterilizing medicine and becoming a permanently medicalized patient for life. It's harm, undeniable harm.
Follow up. So would you say that gender affirming care, that term, is actually a deceptive lie to prey upon unsuspecting people that might fall prey to that term?
Absolutely. It's carefully crafted language. And I would like to point out that if WPATH and all of them really cared about gender affirming care, they would help detransitioners. I'm trying to affirm my gender as a woman, but I can receive no help. They only care about making people trans because they won't help detransitioning people. It's an agenda.
Thank you, Chair.
Final question on this round to go to Ranking Member Liston.
Thank you, Chairman. This one I think is going to be pretty short. I know we're all trying to figure out policy, particularly for Ohio. And so figuring out the practices in our state is important. I can see that you've testified in South Carolina and in Kansas and in Texas. The experiences you're describing, can you tell us, were they in Ohio?
I was in North Carolina, but if you wait until you have a detransitioner from here, someone's already hurt and you have failed.
So, okay, just to make sure that, the discussions and consent practices are not, they were not here. And just final comment, and I would agree that as, the detransition or retransition PS people, do need support. And certainly that would be one of my worries with this bill is if there's a forced detransition that we, don't have support for those young people that might be impacted if this bill were to become law. So I appreciate you bringing up that need. So thank you.
Thank you.
Ms. Mosley, thank you very much for being with us today. We certainly appreciate your testimony.
Thank you. My name is Prisha Mosley. I was 15 years old when trans-identified adults found me online and convinced me that I had been born in the wrong body. After a rape at 14 and multiple mental illnesses, including borderline personality disorder, this was easy to do. My hatred for myself and fear of re-victimization was exploited by the adults around me who convinced me that I needed drugs and surgery to be myself. At 17, high doses of testosterone were injected into my anorexic body, and 1 year later, impacts that I will live with for the rest of my life. My large, painful shoulders match my overgrown heart, an increased risk for heart attack and stroke. My back and joints ache constantly. Even as I sit before you, it hurts to speak. I am suffering with severe vaginal atrophy, which prevents me from even using tampons. Large parts of my adult life were taken from me as a mentally ill teenager, and I mourn this loss every day. My trauma was never looked into, and my desire to hurt myself was supported by my doctors and the community around me. I was exploited in my most vulnerable time, and body parts were removed from me. 2 weeks before I was written my letter of recommendation for breast removal, I was in the mental hospital for another suicide attempt. My letter said that I was stable. My surgeon didn't care about the scars and fresh wounds all over my body when he looked at them when he made me take off my shirt. He was ready to cut me up more. Now I live in a painful body that no longer belongs to me. The trans community tells you to kill your old self with a dead name and everything, and I did. The girl I was gone and has been replaced by a medical experiment. I support any bill that prevents someone else from suffering the harms of gender-affirming care.
I mean, she's absolutely stunning what she is doing. She is doing testimonies all over the United States, standing up against other people going through what she's gone through. These detransitioners need our support, and there's going to be a lot more of them. Sitting here next to her today at this one in Louisiana, the HB 463 and 646 or 648. Yeah, my dyslexia is not like happy with me today. The 648 bill, that's Chloe Cole. She's another detransitioner. There will be links for you to follow up with any of this stuff that I have covered tonight for this episode. If you have the means to help Prisha, please do so. I believe she has a GoFundMe or a GiveSendGo. And it might be in with the article. Let me see if they have it listed on here. I don't see it. I will put it, if I can find it, I'll put it in the show notes. If not, I'm sure that if we do a search, we could find it. She's been through a lot. And I got the other clips off of her YouTube, and I'll put those links in the show notes as well. I just know that as a mother, I can't imagine if I was faced with those words that her parents were given. You know, do you want to pick up her hormones or her body? I can't imagine being in a mental state of mind that way, and the doctors are telling you one thing which really wasn't a cure. And then they benefit from it afterwards. It's heartbreaking. I hope to see you guys all tomorrow. We have another show scheduled tomorrow and Sunday. So we have a Saturday and a Sunday show. But I wanted to cover this case and really, really talk about what was happening and showcase Prisha a little bit. And thank you again, Courtney, for the super sticker. And please hit that like button, guys. If you see below, that's been scrolling, the luckyburritoart.com, the store. If you use hashtag lucky, you save 20% off through my birthday. Well, I put it through August 1st because, my birthday's the 31st of July. So I figured to put it through the 1st. And we got new stickers. like trying to get it. There we go. So it's exciting. We got new stickers with little Leo's face on them. Oh, is that your? Come here then. Can you help me, please? Who does that? Say hi to everybody. All right, everybody. I'm gonna go out and I'm gonna go eat something. So I hope you guys all have a good night, and please hit that like button wherever you're watching this content. Good night.